Hello everyone, welcome to our YouTube annual meeting for December 2016. This is the meeting agenda. We're going to go through all of these different topics. A major unusual incident is an alleged, suspected, or actual occurrence of an incident when there is reason to believe the health and safety of an individual may be adversely affected and the individual may be placed at a reasonable risk of harm. We should report major unusual incidences immediately. There's quite a few ways to report these. These are the different types of major unusual incidents: abuse, neglect, exploitation, misappropriation, death, attempted suicide, known injury, law enforcement, medical emergencies, unscheduled hospitalizations, failure to report, missing individual, peer-to-peer acts, prohibited sexual relations, rights code violation, unapproved behavior support, unknown injury, and any incident that you feel needs to be reported. Some of the trickier definitions on this slide include failure to report. This is when we do not report within the mandated 4-hour time frame. A missing individual is a missed visit. We don't know where a person is during their visit. It's considered a missing individual. A peer-to-peer act is usually in a group home setting where peer A stabs peer B with a knife and causes injury. A rights code violation is when we do not allow a person with disabilities their 24 client rights. Some clients have a behavior support plan, which allows a nurse to discipline a child they care for. If that child were to hit the nurse could have a behavior support plan that would allow them to put the child in timeout. But we are not allowed to provide that behavioral support without a plan. If you have any questions about these major unusual incidents, please let me know. This is what the law states. We need to report the following things immediately. This is the definition of abuse. You can identify abuse in a few different ways: physically, emotionally. Neglect. This is the definition for neglect. Again, report these immediately. Exploitation is when we profit from the client. They give us things like an iPad, or they give us a computer or an iTunes gift card. Anything like that would be considered exploitation, any type of gifts that benefits us as employees. Misappropriation is theft, basically. So it's taking any personal property from an individual. We are not allowed to do that. And the last thing that we need to report immediately is death. These are two confusing MUI definitions. The first one is exploitation. It is a gift, say a Christmas gift. We are not allowed to accept any gifts from our clients. If they bake you cookies, I do not have a problem with you consuming baked goods that were given to you as a Christmas gift, but you should not accept anything of monetary gain from the client. Misappropriation is theft. Please do not take or use the client's property without their permission, and do not take it away from them ever. An unusual incident includes medication errors, falls, peer-to-peer incidents that are not MUIs, an overnight relocation of an individual, and an injury that is not considered a major unusual incident. Please report these immediately as well. We have a very limited time frame to gather all of the information and submit a report to the state case manager. You can report these a variety of ways. How to report an incident. You can call the office during office hours. This is our phone number. If you call the office after hours, you can leave us a voicemail and we will call you. You can text the office to report on this number. It's the number that we text you from throughout the day. You can complete on the portal if it's a medication or fall. You can complete an incident report that's now available on our homepage. On the bottom of our homepage, you can select Incident Report, and it will pull up the incident report for you to fill out electronically. You can also complete the incident report on the portal. It is on the menu at the top of your homepage. You can email alerts@healingtouchhc.com. But the best option is to call the office during office hours or text the office after hours. The most common reasons to notify us are schedule changes before they happen, missing individual or a missed visit, hospital admissions and discharges. These can be scheduled or unscheduled admissions, falls with or without injury, and infections with or without intervention. We're now going to review the 24 rights of developmental disabled people. It's important to know that a disability does not diminish an individual's rights. They have the right to be treated at all times with courtesy and respect and with full recognition of their dignity and individuality. They have the right to have a safe, clean place to live and a place to be alone. They can have food that is good for him or for her. They're able to go to church, temple, or mosque if they want to. They're able to go to a doctor or dentist when they are sick. They're able to have people help them with the way they walk, talk, or do things with their hands, and help processing the way they feel, act, if they need it. They're able to have people help and teach them if they want. They're able to have time and a place to go to be by him or herself. They're able to call, write letters, or talk to anyone they want to about anything they want. They can have their own things and they're able to use them. They can have men and women as friends. They're able to join in activities and do things that will help him or her grow to be the best person they can be. They're able to work and make money. They're able to be treated like everybody else. They should not be hit, yelled at, cursed at, or called names that hurt. They're able to learn new things, make friends, and have activities to do and go out in their community. They're able to tell people what they want and be a part of making decisions or plans about their care plan and life. They're able to ask someone for help and let others know how they feel or what they want. They're able to use their money to pay for things they need and want, with help if they need it. They're able to say yes and no before people talk about what they do at work or at home, or they look at their file. They're able to complain or ask for changes if they don't like something without being afraid of getting in trouble. They should not be given medicine that they don't need or held down if they are not hurting themselves or others. They're able to vote and learn about laws in their community. And lastly, they're able to say yes or no to being a part of a study or experiment. This is our code of ethics This describes the actions that are prohibited during service delivery. We are not allowed to consume the consumer's food and/or drink or use their personal property without consent. We are not allowed to bring children, pets, friends, relatives, or anyone else to the consumer's place of residence. We are not allowed to take the consumer to our place of residence. We are not to consume alcohol, medicine, drugs, or other chemical substances not in accordance with legal, valid, prescribed use, and or in any way impairs the provider from furnishing a service to the consumer. We are not allowed to discuss religion, politics, or personal issues with the consumer or others in the care setting. We are not allowed to discuss personal issues with the consumer or any other person in the care setting. We are not allowed to accept, obtain, or attempt to obtain money or anything of value, including gifts or tips from the consumer, their family members, or household members. We are not allowed to engage with the consumer in sexual conduct or any conduct that might be reasonably interpreted as sexual in nature, regardless of whether or not it is consensual. And lastly, we are not allowed to leave the consumer's home for a purpose not related to furnishing a service without notifying the agency supervisor, the consumer's emergency contact person, any identified caregiver, or the consumer's case manager. Engaging in activities that may distract the provider from furnishing a service, including but not limited to watching TV or playing video games, engaging in non-care related socialization with a person other than the consumer, or furnishing care to a person other than the consumer, smoking, and sleeping. Engaging in behavior that may cause physical, verbal, mental, or emotional distress or abuse to the consumer, or that may reasonably be interpreted as an appropriate involvement in the consumer's personal relationships. Being designated to make decisions for the consumer, like a power of attorney. Selling to the consumer or purchasing from the consumer. Engaging in behavior that constitutes a conflict of interest or takes advantage of or manipulates ODA certified services, resulting in an unintended advantage for personal gain that has detrimental results for the consumer's family or caregivers, or another provider. We're going to talk about our yearly snapshot. We want to thank you guys for your dedicated service to our patients and want to show how you have helped prevent falls, hospitalizations, and infections over the past year. Please keep up the good work in reporting falls, hospitalizations, and infections immediately. So way to go. This is 2015 and 2016 falls. Our highest month in the last 2 years was August of this year. We had a total of 10 falls. The dark red color on these slides indicate falls with injury, and the yellow mustard color is falls without injury. So if you look at January 2015, we had 1 fall with injury and 1 fall without injury, totaling 2 falls for the month of January 2015. We can do a lot to prevent falls. Falls are responsible for the highest rate of hospital visits for injuries. We can decrease injuries from falls by having the client regularly exercise, having them get their eyes checked annually, by reviewing medication side effects with a doctor or pharmacist, and incorporate a lot of home safety features. Install grab bars and non-slip mats in the bathroom, improved lighting, especially on stairs, to avoid using throw rugs, to clear pathways of clutter, to use night lights, and to have adequate footwear inside and outside the home. What do I do when my patient falls? Well, if your patient cannot get up, the first thing you need to do is call 911 because that patient needs help now. Follow the direction of the EMTs for follow-up and education. That means if the EMTs say they need to go to the ER, they go to the ER and receive some follow-up care. Please call the office and report that information and document that on the portal. The information that is necessary is to know the date and time of the fall, any injury if applicable, and corrective action to prevent falls in the future. If your client reports to you that they fell after the fact, like they fell yesterday or last Wednesday, please call the office and report immediately as soon as you know and document on the portal. Again, the information that you need is the date and time of the fall, injury if applicable, and corrective action taken. The most common reasons for hospitalization for healing touch include respiratory and cardiac issues, scheduled treatments or procedures, uncontrolled pain, acute mental health behavioral issues, diabetic issues, urinary tract infections, and injury caused by falls. These are our hospitalization trends for 2015. Our high months for 2015 include January and July. For 2016, our highest month was November. These are our 2 years side by side, so you can see the high and low months. Our hospital rates did decrease this year by almost 8%, so we need to do whatever we can to keep our clients home and out of the hospital. The infections for Healing Touch 2016 include respiratory infections, UTIs, skin infections, musculoskeletal infections, sinus infections, GI, ear, reproductive and wound infections. For 2015, our high months were January, February, and April, with a total of 6 infections reported in each month. In 2016, our highest month was July. On this slide, you can see our 2015 and 2016 infections side by side. This year, reported infection rates increased by 15%. So we want to do whatever we can to prevent the spread of infections. The best way to prevent the spread of infection? Let's talk about that. This is our hand washing competency form. It's currently available on Google Forms as a part of your attestation document, but this is what the paper form looks like. So if you are completing this on paper, you will need to put your name at the top and then complete these 6 questions located on the hand washing competency evaluation form. Hand washing, this is that form that is attached to the YouTube video and was emailed to you. Please go and print out this document, and we're going to answer the 6 questions at the top together. The first question is, when should you wash your hands? These are the appropriate answers according to CDC, but you can wash your hands all the time. My 2-word answer for this question is usually before care, before providing any care to your patients. How long should you wash your hands? CDC says to scrub your hands for at least 20 seconds. And on their website it says if you need a timer, to hum the birthday song twice. What is the first defense that the body has against infection? Skin is the number 1 answer. There are plenty of other things that do help us defend against infection, like tears, mucus, and saliva, cilia, stomach acid, urine flow, friendly bacteria, and neutrophils. Number 4, what is the number 1 defense we can do to prevent an infection? The answer is to wash our hands. How many times should we use hand sanitizer before hand washing is required? The answer in home health is 5 times. You can use hand sanitizer 5 times before you must wash with soap and water. In acute settings, they say you're only allowed to use hand sanitizer once, and in long-term care facilities, they say 2 to 3 times. It's always best practice to wash your hands with soap and water. What else must we use for infection control besides hand washing? Any PPE equipment that includes gowns, gloves, head covers, masks, eye pro. And we're going to simulate washing our hands. You can actually go to a sink right now and practice your hand washing, but we want to make sure that we are doing it long enough. So we're going to imagine a sink, or you can go to a sink at this time and turn the water on, wet your hands and wrists with clean running water, and apply soap. We're going to lather our hands by rubbing them together with the soap. Be sure to lather the backs of your hands, between your fingers, and under your nails. We want to scrub for 20 seconds. 20 seconds is longer than you think it is when you're washing your hands. I will tell you when 20 seconds is up if you're still scrubbing. Make sure you get your non-dominant thumb and your wrists. Get under your nails. All right, we've met 20 seconds. We're going to rinse our hands well with clean running water. We're going to dry our hands off with a clean paper towel and turn off the faucet with that paper towel or a clean towel. The flu vaccination program is also here to help us prevent infections for our clients. The flu is contagious 1 full day before you have symptoms. The U.S. Department of Health and Human Services tells us that vaccination is an effective preventive measure against influenza and may prevent illness, death, and loss in productivity. This is intended to help protect you and your patients, to reduce the disease burden, and to decrease healthcare costs. Please participate in the flu program. This includes a form that is filled out and signed by you stating that you have received the flu shot or you have not, and you need to sign the form. This can also be completed online, and we have text to the link to everyone. Joint will ask you if you received flu vaccine education, and this was provided in the annual meeting and via email. You received a flu education form. Medication administration records. Best practice is that the care team use the same MAR for each patient. A patient-specific MAR is emailed to everyone represented on the care team. The nurse assigned for the first worked day of the month should print it out for the team and leave in the folder at the home. Initial the medications administered with the initials next to the correct time of administration. So you can see on this little picture at 8 a.m. Emily Allen gave medications, and her initials are next to the medications that she gave. You do not need to mark out that line if you did not give the medication. If you did not give the medication, please leave it blank. If the parents give the medication, leave it blank. If the client self-administered the medication, leave it blank. You only initial if you administer the medication. Please initial next to the name printed at the bottom of the page. You can see down under assignments. It says Agency Case Manager, Emily Allen, and the initials are down there. So you can see which nurse gave which medications. MARs are due by the 5th of the following month. Example, the November MAR was due this past Monday, December 5th. There are 8 rights of medication administration. Make sure you have the right patient, the right route, the right drug, the right dose, the right strength, at the right time. Make sure you give the right documentation, and remember the patient has the right to refuse. Medication updates. Please notify the office immediately with medication changes or updates. Anyone can call medication updates. The clients can call us, the nurses can call us, the aides can call us. The nurses can give us medication updates via the portal. You can call the office and report it over the phone. You can email meds@healingtouchhc.com. You can fax a copy of the order, or you can text or send a picture to the on-call phone number. Nurses, please document all new medications administered in the blank sections available on the bottom of the current MAR. New MARs are sent each month to the email address on file. They're also available for pickup in the office if you don't have an active email address. All medications should be documented for our patients. They include prescribed medications, over-the-counter medications, vitamins, and supplements. These are some reminders regarding medications and waived testing. Home health aides can provide medication reminders. They can apply non-prescription creams, lotions, and shampoos. And they can apply prescription creams to an alert-oriented patient. Home health aides cannot administer medication. They shouldn't handle medications, the tablets or capsules. They cannot apply creams or lotions to non-alert patients, and they should not perform blood sugar checks in home health care in our state. LPNs and RNs, make sure you have an updated 485 with you if you're providing care. You must document medications administered on the MAR. And the annual waived competency is completed every year, and we did that in July. Our biggest goal for 2017 is to improve patient satisfaction. What can we do to make a difference in the lives of our clients? In our meeting in the office, we talked about the 5 aspects of clients and discussed ways we could improve our clients' lives when we provide services. It's a good thing to think about. We should be focused on the patient's best interest. That includes no smoking while at work. There aren't any smoke breaks in home health care. If needed, get some gum patches or stop smoking. Smoking is not only unhealthy for you, it can be life-threatening for your clients. You should not smell like smoke, animals, body odor, or perfumes when taking care of clients due to allergies and respiratory issues. Please shower before your shifts, wear fragrance-free deodorant, and please do not use sprays, lotions, or perfumes that are hefty in scent. And visits and shifts should be worked as scheduled for the best interest of the client, not our best interest. CNA STNAs are required to complete 12 in-services per year. This maintains your CNA, and we will maintain your STNA through the state. You can complete these online or in booklet form, and you can work ahead. For RN LPN, you're required to do 24 CEUs, including 1 law CEU every 2 years. RNs are going to renew their licenses in 2017, so look for the mail or email to renew. If you renew before July 1st, it's only $65, and this date may change because they've moved to an electronic portal, and they gave the LPNs until October 31st this year. So we will see what happens in 2017. How to get paid. The best way is to document services provided on the day of the visit shift via the portal. Signatures are required at the end of each shift, preferably on the portal, but you can also do a weekly timesheet that your client can sign for the week. Payroll is processed daily in our system, and then we send it to ADP once a week, typically on Tuesday mornings. Payday is Monday of each week. The HT portal should have all completed documentation submitted by midnight on Sunday night. If it's not, it will be missed and on the next week's payroll. Paper timesheets, the signatures, etc., are due on Monday by 1 p.m. Not submitted timesheets or incomplete timesheets will not be processed. That means if they're missing signatures, they have incomplete interventions, or missing a timeout, they will not be processed with this week's payroll. They will be sent back to you for corrections. So please be checking your email once a week, and we also send a reminder text as well. Late timesheets will be processed with the next week's payroll. Improving communication with our employees. It's really important that we have current personal information for you in the office. We need to notify you if your client has a schedule change, if they're hospitalized. We need to make sure you get your yearly evaluation, and we notify you of changes in policy, usually via email. W-2s will be mailed out by January 31st, but as soon as we get them in the office, we will notify everyone to come pick them up if they want them before that. Please make sure that we always have your most current information. That includes your phone number, home address, and email address. If you were present at the meeting today, you would have seen it on the sign-in sheet, but please, when you're sending in your attestation statement, make sure we have the most updated information. It's also a really good idea to have an emergency contact on file. If the office is unable to reach you for more than 4 business days, we do have a policy that may make you inactive. So please stay in touch. The non-compete, non-disclosure, and non-solicitation agreement was signed when you were hired at Healing Touch. This means that you will not take clients assigned to you by Healing Touch to other agencies. This does not include family members or clients brought to the agency by you. The violation of this agreement includes violating patient confidentiality, making the use of, soliciting, or disclosing client information provided by Healing Touch, to solicit the trade of current or prospective clients to another agency, or if you work for assigned clients for a period of 1 year post-termination. If you choose to violate this policy, these are the ramifications of that. It is $5,000 for breaching the contract and $8,000 per client lost that you take away from our agency. So we just wanted to review this information because you did sign a legal contract when you came to the agency that you would not steal Healing Touch patients. We do want to thank those who are exceptional for doing a good job at Healing Touch, and usually we do this by sending out postcards. So this is what you want to look for in the mail, another good reason that we have your current address. Collect 3 postcards, and you can redeem them for a $15 gift card to Kroger or Speedway or another location. The attendance policy, please provide a 2-week notice to the office in writing if you want to take time off. As in all healthcare organizations, a request for leave must be approved. If you're unable to work your shift due to an emergency, please call all the other members located on your patient care team. They're located on your face sheet, and notify the office you are unable to work. Reminder, if your client's not home, you cannot work in the home. Call phone number is 937-541-0090. This is the number that texts you throughout the day. Our on-call Phone is available to you after office hours, on weekends, and on holidays. Reasons to call. You can always call us for client updates if a client goes to the hospital, has a fall or injury, if someone is filling in for you, and if you have any issue regarding patient safety, an MUI or UI. If no one answers, please leave a detailed message, including your name, your client's name, a brief description of the need and situation, and we will return your call within 30 minutes if it is an emergency. If it is not an emergency, we will return your call the next business day. Please do not call the on-call phone for payroll questions, for time off requests, or permanent schedule changes. These are things that can be handled the next business day because we need access to our systems and able to help you at the office. If there is inclement weather, WHIO would let you know if the office is closed. However, we are able to help you from home, and we will be working from home if the office is closed. As healthcare employees, we provide care to individuals in need. We are always required to report to work to care for those clients. If you're going to be late, please notify the office before your scheduled shift, and we can contact your client to let them know you are running behind due to the weather. If there is a snow emergency level 3, all total care patients that are categorized as moderate or high are required to have services regardless of weather issues. If your patient is categorized as low, we will notify your clients of the snow emergency and services will be canceled or rescheduled due to the weather. Please identify if your client is a moderate or high risk before snow level 3 is announced. This information is found on your face sheet right under the patient name. For winter weather, these are the 3 snow emergency classifications. In healthcare, we provide services even if the weather is rough outside. A level 1 snow emergency classification is identified as roadways are hazardous with blowing and drifting snow, roads may be icy, and motorists are urged to drive very cautiously. A level 2 snow emergency would indicate that roadways are hazardous with blowing and drifting snow, roads may be very icy, only those who feel it is necessary to drive should be out on the roads. I'm telling you this right now, you do not need to contact us, you should report to work. But please use extreme caution in transportation. For level 3 snow emergencies, all roadways are closed to non-emergency personnel. No one should be driving during these conditions unless it is absolutely necessary to travel or a personal emergency exists. Since you work in healthcare, all nurses are required to make it to work, so please use extreme caution driving. If you are an aide assigned to a client with a low disaster evacuation status, services will be rescheduled for a different day, and you can find that information again on the patient's face sheet. For your holiday schedule, you are required to work all days you are scheduled by the office. However, if your patient does not want services on a holiday, please notify the office of the schedule change prior to the missing shift. We will verify the schedule change with your clients and notify state case managers and the doctors of this missed visit for you. If you do not notify the office of a schedule change, you may be written up for a no-call, no-show for your patient. Schedule. Follow the schedule provided by the office. Clock in, out should be equal to the scheduled shift. Example, if you are there for a 4-hour shift, please document your clock in, out to equal 4 hours. We cannot bill or pay for more than what is authorized. All schedule changes must be approved. Please notify the office if the client would like to make a schedule adjustment for their doctor's appointments, for the holiday schedule, or if they have a preference change and they'd like you to come at a different time. Unapproved changes in the schedule may result in unpaid services. Please be aware of that. The HT Employee Portal is something that we've been working on for the past 2 years. The website is www.htemployee.com. Your username is your employee badge number, and your password is typically your birthday and a 4-digit code with the month and day. Please document your visit shift on a computer or a tablet, the date of service. It's designed to be completed the day you are there. You must complete it the day of service, and it must be equal to the scheduled shift. Documentation can be completed on a computer or on an internet-enabled device. Education on Portal is available. I'm going to make a YouTube video for that as well, so if you need extra help with that, I will have that available shortly. This is what the HT Employee home screen looks like. You'll enter in your username and password and sign in. Thanks to everybody who has been using the portal faithfully and have reported issues or problems with the portal. We've made a lot of updates and improvements over the last 2 years. But we would love more suggestions to improve the portal, so any feedback you have is welcomed. Please let us know if you are having issues with the portal, and we will assist you with those issues so you can document appropriately. The portal documentation is best practice. It submits payroll daily. It has a self-audit installed in it. It saves time. It improves accuracy. You're always able to view your timesheets later. You can edit them if needed, and the schedule is available for view. We do also have a paper timesheet option that is patient-specific for your patients. This is the paper aid timesheet that is used for documentation when the portal is down. Please make sure you are using the legend to complete on the home health aid task list. The check mark indicates the intervention was completed. R indicates the patient refused that intervention that day. C indicates that it was previously completed. And N means that the intervention is not applicable to the patient. Please make sure you are documenting accurately. It's really important for insurance authorizations. And please document what really happened during your shift. All intervention boxes for days worked should have something in each box. This is the skilled nursing paper timesheet that is used when the portal is down. It's really important that these timesheets are completed in entirety before submitting to the office. Please make sure your timesheet is updated, that you have the date and exact time worked. Make sure you obtain the client signature during the day of service. Indicate what is being completed, either a shift, visit, or fill-in. Complete the 10 assessment boxes. Address each skilled nursing intervention, either with a checkbox or an NA if it's not applicable to the shift or visit. Summarize the visit, that the patient tolerated the visit well, no complaints at this time. Make sure that we can read it. Review medications and falls, and then sign and date your timesheet. Documentation requirements. We've made it really easy for you to submit your timesheets daily or weekly. You can use the portal. You can email them in. You can fax them. You can use the drop box before 8 a.m. on Monday, or you can come visit us during office hours. Timesheets are considered late if they are turned in past the deadline. If your timesheets are more than 1 week late, we will give you a verbal warning. If they are more than 2 weeks late, you will receive a write-up. If they are more than 3 weeks late, you will receive a second write-up. And if they are 4 weeks late, you will be terminated because that documentation is required. This is the attestation phrase that is needed for your Google Forms document. The attestation phrase is safety first. The takeaway message from this PowerPoint presentation is to try to figure out how we can protect our clients from infections, hospitalizations, and falls. How can we make a difference in our statistics? The office support staff is here to help you. You have Fahad that helps a lot with the HT portal. You have Jennifer, who deals with schedule questions and accepting cases. Marcella helps you with your personnel file and payroll. Becca helps with insurance authorizations. Laura helps with medication updates, portal issues, and care plan updates. And I help with clinical questions and client updates, MUIs and UIs. We're all here to help you however we can. So Merry Christmas, everybody. We do have gifts available in the office, so when you have time, please stop by and grab one. They will be here and available to you up through January, so anytime you can come in, we'll have them available. Thanks for all you guys do for us and your clients. You guys are awesome.